All right, so in this first module of our postural restoration course, we'll be focusing on helping you assess for and restore tightness and mobility restrictions within an area of the back known as your thoracic spine. So the thoracic spine is made up of the 12 vertebrae that sit below the 7 vertebrae of your neck, which is known as the cervical spine, and also above the 5 vertebrae of your lumbar spine, which make up your lower back. Now, this is the area where your ribs attach onto. It is also the area where your body is going to generate the majority of the twisting and rotation and also backward bending motion as well. And this area also serves as the foundation for which shoulder range of motion is going to originate as well. And the reason why we need to place so much focus on this area, because this is the part of the body that is going to be the most greatly impacted for people who are spending the majority of their day either looking down at their phones or just kind of hunched over a computer screen all day long. And what's going to happen is when this part of the body starts to get stuck or stuck in this forward bent position known as hyper-kyphosis, what's going to happen is most people don't realize the fact that they will actually start to lose the range of motion and mobility of these vertebrae. Now, this is very similar to if somebody broke their arm and need to be put in a plaster cast all day long, where the person would actually lose the ability for their elbow to actually bend, which is obviously going to cause problems. The problem is, since the changes to the spine happen so slowly over such a long period of time, most people aren't even aware of the fact they've even lost this range of motion of their back. However, once we can help you realize the fact that literally 2/3 of your back might be stuck and actually does not move, and then start to target this area with a couple of basic stretches and exercises so that you can start to unlock and restore this range of motion and mobility, then it's actually pretty cool to see how much better you will start to feel almost immediately once you start to restore the motion within these vertebrae. So what we're going to do first is to show you a couple of very simple ways to first assess to see how tight or how stiff you actually might be within this area of your thoracic spine to make sure that this is a problem that you actually need to correct. And from there, we will share with you some of our favorite ways to help you unlock and restore the range of motion and mobility within this area so that you too can start to feel better almost immediately as well. All right, so with us today is my wife, Twee, and she's going to be helping us through some of the exercises and some of the demonstrations as well, all right? Now, the first thing that we want to teach you is how to perform a simple range of motion assessment for the middle part of your back, also known as the thoracic spine, and we're going to be focusing on a motion known as backward bending, which is also known as extension, all right? So Twee, go and demonstrate. So we're going to be using a foam roller here, and I think that this is probably the best piece of equipment to be able to both help you assess and also help you restore some of the tightness you may have within this area, right? So what Twee's going to do is she's going to lay on the roller crossways and just kind of have the roller right between her shoulder blades. And then from here, all she's going to do is try to perform a backward bend over the roller and just try to touch her head to the floor like so, all right? Now, Twee, she's quite mobile and she doesn't have a lot of restrictions within this area. So as you can see, she's able to touch her head to the floor with ease. And this is what we're looking for to make sure that you have a passing test if you are able to touch your head all the way towards the floor, all right? So Twee, go and come back up. However, for a lot of people who are very tight or who are very restricted within this area, as they try to bend backwards, they'll start to get stuck, a part of the way down. So Twee, go and demonstrate. So if this is happening to you, and as you go down, you feel you just kind of run into a lot of tightness or a lot of resistance, or just can't quite get your head to the floor, then this is the first sign that this is something that you absolutely need to work on. And then this is absolutely one of the best ways for you to start to restore this range of motion over time as well. All right. So Twee, go and come back up and reset. So what we want to do if you are someone who is very tight or are very restricted within this area is to be able to form a stretch right here, right in this position. So Twee, go and demonstrate. So once you start to go down, if you start to get stuck about halfway down, just kind of stay right there. And just try to stay there for a couple of seconds, all right? Just give your body a chance to just kind of settle in, to try to relax. And then from there, just take a couple nice deep breaths in. And on an exhale, just kind of slowly start to bend back over the roller, just as far as your body will be able to take you, all right? Make sure that you don't push through any pain. Make sure that you aren't pushing through any, sharp discomfort. Just kind of give your body a chance to adapt to the stretch, and over time, you should be able to go back a little bit further, all right? So let's have you take one more deep breath in, breathe out, and just go down a little bit further. And you want to repeat these breath cycles for about 5 times for each set, and then very slowly over the course of a couple of days, or even over the course of a couple of weeks, then you should be able to bend back with ease over time. All right. So have you breathe in one more time, and breathe out. Perfect. All right. So this is an example of how we would perform this exercise within the middle part of your back, but we also want to recognize that there are 12 vertebrae within your spine. So we want to make sure that you perform this cycle. Go ahead and move up your back a little bit. So you want to make sure that you perform also this test and also this kind of stretching cycle within the first 4 vertebrae up closer to your neck, like so. So go ahead and demonstrate. All right, and then come back up. And we also want to make sure that you check for the bottom 4 vertebrae as well. So just a little bit lower from the first spot, and then repeat the same backward bend. All right, so go ahead and first make sure to see if you can bend. And if you can't bend, then you start to practice some breathing exercises to very slowly start to guide your spine back down. And this will start to unlock the ability for your back to be able to bend, which will then help you gain access to a lot of the other stretches and exercises that we're going to show you for the rest of this program. All right, so the next exercise we're going to show you in this thoracic mobility module is to teach you how to both assess and also restore the twisting or rotation aspect of the middle part of your back. All right, so Tweet, let's go ahead and demonstrate the open book. All right, so what Tweet's going to do is she's going to start by laying on her side like so, and we're going to use 2 pillows here just to make sure that she has adequate support for her neck. And what she's going to do is try to just bring her knees up towards her chest a little bit, and then use her left hand or her bottom hand just to kind of block her hips and to block her thighs. And then she's going to take her right hand and just kind of slowly start to create a twisting and rotation motion to try to essentially touch her right hand and her shoulder all the way towards the floor like so. All right, and as you can see here, Tweet's quite flexible, she's quite mobile, and she's able to touch her hand all the way towards the floor. And this is known as a passing test, and this is what we hopefully want to achieve when you do this exercise, all right? So Tweet, go and reset. However, for a lot of people who might be tight or who might be restricted within this motion, Tweet, go and demonstrate. As they perform this open book, they actually might start to get stuck or might feel a lot of tightness or a lot of restriction, halfway or 3/4 of the way through. And similar to the roller stretch, if you are tight, if you are restricted in this stretch, then just try to stay there for a couple of seconds, take a couple of nice shallow breaths, and then take 1 deep breath in, and on your exhale, just kind of slowly let your shoulder and let your spine twist into a deeper stretch like so. And you want to repeat this for about 5 times. So let's have you demonstrate again. Exhale, a little further down. And one more time, deep breath in, exhale, and let's go a little further towards the ground like so. All right, so let's demonstrate it on the other side, just so people can see what it looks like on the other side. All right, so again, just lying on her side, pulling her knees up towards her chest, using her right hand in this case to block her hips and block her thighs, and then she's going to try to touch her left hand all the way towards the floor like so. Again, if you're able to touch your hand, if you're able to touch your arm all the way towards the floor, that means that you have pretty good motion within this area of your back. Go on and reset, Tweet. However, for people who might be tight or who might be restricted as they try to go into the stretch, go ahead. They might start to feel some tension or some restrictions, especially within this middle part of the back. And if this is happening to you, then just try to stay there for a couple of seconds. Take a couple of nice shallow breaths just to let your body adapt, and then take a nice deep breath in. On your exhale, just kind of slowly push into a deeper stretch like so. All right, and then just try to hang out there for about 5 breath cycles or until you feel your body's kind of had enough. All right, let's demonstrate one more time. Deep breath in, exhale, and go a little further into the stretch like so. 3, 2, 1, and reset. All right, so that's it for the open book stretch to help you both assess and also restore the twisting and rotation part of the middle part of your back.